So this is going to be a video about the Bipap that we use here at my clinical site. It's called the V60. So first I'm just going to go over some of the external things that you might see, and then we'll go ahead and turn it on and talk about how to change the settings. So this is just what it looks like on the outside. You do want to make sure that it's plugged into the red outlet, so it's attached to the backup generator. This type of system does use oxygen, so you can attach oxygen to the wall outlet. You can also see I have two E-tanks with the regulator, so you can also attach to those for transport, etc. I will not be using oxygen as part of my video, but just know that you do use oxygen with a Bipap, and Bipaps can be heated humidity or not. This particular setup that I have here is for heated humidity. So looking on the outside part, you can see this thin line. This is pressure, the pressure that's going to go to your patient, and then this is part of the heated humidity. So this is going from the machine and it's coming down here into the chamber. I do have this little spike, and that's what we use. We spike this bag of sterile water for oral inhalation. The water then fills in this little Fisher-Paykel chamber, which you can attach and detach just by sliding it in and out, just like so. You can notice that, so this is coming from the machine into the water. This side is the side that's going into the patient's circuit. So there is a temperature probe here on the top of the chamber, as well as a temperature probe here near the patient's interface to keep track of that temperature. You can also see that here's the pressure going to the patient, and we do have an exhalation valve. So this is normally where you would have your patient's mask, but I am going to have my test lung here instead. So we've kind of gone over all of these things you see on the outside. So I'm going to go ahead and bring this a little closer, and we're going to talk about the settings and how to adjust the settings on the Bipap. So you just go ahead and push the on button here. I'm going to get an alarm right away that's going to tell me my oxygen's not available. I'm not going to put oxygen on there, but just so we know. I'm going to kind of show you this as best I can with this test lung. So you can see the difference between the IPAP and the EPAP. Okay, that's exhalation, inhalation. So you can see that there is a pressure difference between the two. Okay, so when we are on the Bipap, we can see the pressure, the minute volume, and the volume, or minute ventilation and the volume. So we have our IPAP. Normal IPAP is between 8 and 20 centimeters of water pressure. EPAP is usually between 4 and 15 centimeters of water pressure. We do need a pressure support of at least 4 between the two. So our respiratory rate anywhere between 8 and 12 to 20 breaths per minute. Our inspiratory time is about 0.8 to 1.2 seconds for a normal. We also have the rise time. The ramp is used for patient comfort, and that is how quickly they will get to the IPAP. And then we have our oxygen. So on this type of system, the oxygen can be room air, 21%, or it can be all the way up to 100% oxygen. So to change any of these settings, all you do is click them, and then you can see there's an arrow up or down. You choose how you want that to be, and then you push accept. This machine also will tell you your inspiratory to expiratory time. So you just have to keep in mind that obviously, because expiration is passive, it does take at least double the amount of time to exhale as it does to inhale. So that kind of helps you with an idea of that. So once you choose the setting you want, you'll just push accept. This type of system also is not just a Bipap, it's BiPAP, AVAP, and a CPAP system. So the difference between the IPAP, or the BiPAP, and the CPAP is that CPAP is giving one constant pressure throughout inhalation and exhalation. With BiPAP, you're getting pressure, but your pressure against exhalation is not as strong as the pressure against inhalation. So the pressure does change between the two cycles of breathing. So that's just sort of the basics. If you want to change it to CPAP or AVAPs, you just click modes and then you have your options. So right now we're on spontaneous timed BiPAP, which is the most common. And then you could of course choose CPAP if you wanted, but that is basically how you run this system.